Hello, good evening. This is Tally. I am your host tonight for our monthly or every other month Secrets of the USMLE, how to dissect any question on test day, particularly for the USMLE Step 1. We've got the neurology edition tonight, so really excited to get a little brain time, into this. So my name is Tally. I'm an associate clinical professor of allergy immunology at the University of Louisville, but most of you folks know me better as the editor for First Aid for the USMLE Step 1 and First Day for the board series. I'm also editor-in-chief for USMLE-Rx, our bricks, our video series, and so forth. My co-presenter tonight will be Paris Vicaria, one of our Rx coaches. Paris, do you want to say hi?
Yeah, thank you, Dr. Lee. Hey guys, my name is Paris. I'm a dermatology resident at UT Southwestern in Dallas, Texas, and I've worked with USMLE-Rx as an Rx coach, working with students one-on-one in regards to the USMLE Step 1 and Step 2 CK as well. And I'm happy to help with tonight's dissection.
Great. We also have some wonderful panelists as well too, also from Rx Coach. So up next is Sean Nanji. Sean.
Hello everyone, Sean Nanji here. Been with Rx Coach for about 2 years, working with wonderful coaches like Boris and Alec and many others. Looking forward to answering your questions this evening, and looking forward to another wonderful webinar.
Great. And then we also have Alec.
Hi, everyone. My name is Alec. I'm a fourth-year medical student at Cooper Med School in Camden, New Jersey, applying to orthopedic residencies right now. I joined RX a couple months ago after I used it for both Step 1 and for Step 2, scored 260s on both of them, and I think using RX was a big part of that.
Great. So really delighted to have multiple coaches with us tonight. They'll be, while we are presenting, our coaches are available to answer your questions in the question box. So here on PC, Mac, there is kind of a question control panel on your screen on the PC for sure. For example, it's on the right side. If you're on an iPad or an Android device, it's going to be, I think, in one of the tabs at the top or bottom. So you can place a question, and they'll do the best to help you. And also, if you have further questions, you can schedule a free consultation with an Rx coach, and we'll tell you how to do that. And I'm sure Jeff will probably drop the link in there as well too, as we go through this presentation. Before we get too far, I want to learn a little bit more about you folks. So I'm going to open up a poll, and I want to find out who you are. So there's several hundred of you folks out there tonight, so it's a great crowd, but I want to know where you're from, or what type of student you are. So tell me if you're a U.S. student, international student, allopathic, so forth. So just give us a quick hit up on that poll, and I'll when we're done collecting results, I'll share it with the group. Right now, it looks like about a third of you folks have answered. Leave it open for another 10-15 seconds. It does take a little while for all the results to tabulate. All right, great. We're close to about 70%. So let me go ahead and close the poll and share the results. And what we see tonight is a heavy international audience, some U.S. students. So great to see all you folks here. Then next, I want to know when you are taking the Step 1. Is it in the next couple of months, sometime next year, or beyond? So go ahead and answer that question as well, and then I will share the results with everyone. And by the way, this is all confidential. I don't know who you are, so don't have to worry. But it's just good data to be able to share with other folks so people get a sense. All right, about a third of you have answered. Again, I'll leave this open for another 10-15 seconds to tabulate data. All right, most of you have answered. Let me go ahead and close and share the results. And what we see here is the majority of you folks are actually taking it early next year. That's interesting. Normally it's towards the summertime, like May through August. So some of you may be doing it off cycle, but there's no wrong answer. And I also noticed that close to 20% will be taking in 2022 or later. And obviously there's some significance to that, which we will cover shortly as well. All right. Let me see here. So let's go through our agenda here. I'm going to start off with some USMLE updates. Then we're going to talk a little bit about Rx Bricks and how that can be used to help support your learning and how our coaches are actually using them as well too. Then we'll talk about our approach to questions. That's where Paras will be taking you through that process. We'll be doing a number of example question dissections in neurology and neurosciences. Paras will wrap up with some dissection tips. I'll cover some high-level study tips. We do have a raffle and a special offer. The raffle is very special indeed. It's 6 months of RX 360 plus access. So that's our question bank, our videos, our flashcard, and our bricks, our curriculum bricks, and access to first aid, and as well as 5 coaching sessions. So it's a package that's worth about $1,000, and there are 2 of them that we are raffling up tonight. And to be eligible for the raffle, you need to be around, towards the end. We'll pull in a couple names for those people that are there at the end, and then we'll call out a couple of winners. But on top of that, there is a special offer, and where you can save significant money on our learning resources. And then at the very end, we'll open up for Q&A. All righty. So let's get going. So as I mentioned, let's start with some updates. As many of you know, USMLE Step 1 is going pass fail. They just reaffirmed that that's going to be that's on track to be implemented in January 2022. Obviously, stick around for updates from ECF. I'm sorry, from NBME, USMLE, and through ECFMG. A common question that often comes up is, what happens to your scores if you take it before that time? They will still report your 3-digit score if that's available. So nothing changes with that 3-digit score, even if you apply after USMLE Step 1 goes pass fail. Okay. All right. Next, want to talk a little bit about Step 1 content distribution changes. It affects both Step 1 and Step 2 CK, but again, this question dissection is mostly for Step 1. The key thing to know is that as of a couple of weeks ago, Step 1 has been increasing the number of items that are assessing communication skills. That's something that we'll be covering in the new edition of First Aid for the USMLE Step 1 that will be coming out late next month. That's also something that we'll be addressing through our question bank as well too. There'll be new items in our bank that will be launching in the next month or so, and that's something that in fact our RX coaches will be teaching on as well too. And also later on, for those who are doing Step 2 CK, you'll see more items with regards to system-based practice, healthcare delivery, patient safety, and professionalism. Pharmacology is also an area where there's some change. On Step 1, what's going on is that the focus, there will still be questions on drug mechanisms and adverse events, but they're going to do less about pharmacotherapy. So they're not going to ask you as often to identify specific medications for a specific change. On the Step 2 CK, that's still something that you will see. All right. So, at a high level, what type of questions do you see on the USMLE Step 1? In particular, it's the 1 best answer items. So, a question, usually a case with a lead-in, and then 4 to 7 options, right? A couple will have, about 15% of the time you'll have some clinical image. A couple times you'll have multimedia like audio, heart sounds, that type of stuff. As I mentioned, most of the questions are case-based, And the majority of them actually have multi-step reasoning, so they'll integrate multiple concepts together. So you may start off with a pathology type situation where you have to make a diagnosis, but then you have to, but then they ask a question about genetics or an anatomical structure or some physiology. All right. With regards to the thrust of the various steps, you will often, for the step one, see, you'll see just about any of these on all the exams, but on step one, there's a special interest in mechanism. On step two, it's going to be more diagnosis. Step three, it's more management. And then, particularly in step one blueprint, while there is, what we call the, hardcore basic science, what's going on is you're actually having to apply these foundational concepts, in clinical, in these very simple clinical scenarios. So on top of that, obviously, that's where you'll see the clinical pathology and the physiology. And so when you're trying to master these concepts, it turns out that, there's not too many resources that do a really good job integrating them. So that's actually why we developed bricks, and so if you haven't seen these bricks, do check them out. We actually have a bunch of free bricks you can try out. In fact, we essentially give away a whole course of bricks, both in cellular and molecular biology here. That's completely free. It doesn't cost you a dime. You can get this right now without a credit card. And general microbiology, right? So everybody needs help with micro, right? And then there's bunches of other bricks too. A total of 150 bricks for free. In addition, of which, like I said, you can get full access to a full micro course and a full cell, essentially a biochemistry course. And you can see that we cover all the organ systems, all the major disciplines. But again, given tonight being neurology, we're going to spend a little extra time here. You can see that we have it broken down into normal nervous system in terms of anatomy, physiology, and so forth. Then we break it down into disorders as well too. And you can see it's really deep and very, very rich. So let's go into a brick. I'll show you what it looks like. You can see that we provide learning objectives. We provide the amount of time that you need to go through in a single pass. Obviously, you can spend a lot of time on this, and people do when they really want to learn. But if you're really just trying to get the high level gist and doing a single pass, you can do this in about 15 minutes. Every brick starts off with a case, because we want you to be able to apply these concepts. I don't care if it's as basic as the Krebs cycle or T-cell maturation. If it's worth teaching, it's worth applying in a clinical scenario. And so in this particular case, you meet a patient who's had a basal ganglia hemorrhage, and she says, and she's saying, that she can't move, but she still has feeling. And so what's going on? I don't get it. So how do you explain this? And so, when we talk about these cerebral hemispheres deep structure, you'll learn more about what the issues are, and then it allows you to be able to answer that question. We teach in a very narrowed way, so it's not like any textbook you've ever seen. It's casual. We stick to the big concept. It's super helpful for building your mastery of fundamental concepts and foundational concepts. And so that's why we try to keep it more focused on the frameworks as opposed to the minutia. Obviously, you'll get into the details with first aid. That's what first aid's all about, to get you that 250. But when you're just trying to master the concepts, we try to do it at the high level. And you can see that it's well illustrated. It has multimedia. It has the ability, for you to test yourself. We have flashcards built in that test you on the major learning objectives. We have lots of diagrams. Some of the diagrams are actually interactive. We've got lots of clinical correlations. So here's an example of interactive diagrams. You can see there's a lot of structures here, and you may wonder, hey, I might need to test myself on this. Well, there's a couple of things. You can zoom in, you can mag this up, and then you can go to quiz mode and you say, oh, what's that? Oh, that's the mammillary body. So you can use this to test yourself on the different structures in the brain, right? As a quick quiz, right? And so just click on, what structure you test yourself on, and then you click on that structure for the answer. All righty. And then, as you go along, you can annotate, you can highlight. There's a number of things you can do with each brick. And at the very end, when you get to the very end of a brick, we go back to that clinical case, and based on what you learn, we propose a model response that you could use to explain to the patient. And so this again allows you to apply it. You model the answer, and and it gives you again a way to to link it to something that realistically you'll encounter as a 3rd or 4th year medical student, or as a resident, or as a physician anywhere in the world. All right. At the end, we have a high yield summary. That gives you all the key facts that you need to know. And then there are practice questions, and you'll notice that when you get it wrong, you don't get the answer until you get it right. So here I got right on the 4th attempt, and then only then did it give me the explanation. And then at the very end, you can actually go into first aid. And so if you need to then link it to the high yield facts, then you can go to the key facts that are curated. In this case, let's go to basal ganglia, and then there you can connect everything you learned directly in first aid. You can highlight anything here. You can annotate. You can navigate to other parts of the book, right? As you see here, this is directly out of first aid. And then when you're done, you just go back into the timeline, we call it related history, and you get back into the brick, once you're done exploring first aid. And you can also go to our curated flashcards. So there are, 50 flashcards about deep cerebral structures, 2 express videos that are high yield videos that are good for board prep and for a high yield summary. And then 10 QMAX, high quality USMLE style question for practice. And again, this is what obviously your RX coach will be drilling you on, when you're working with them. So hope that helps. Hope that gives you a high level sense of how useful the bricks are, and how they could be a part of your studies with QMAX and other preparatory resources. All right. So I'm going to move in, and I'm going to hand it off to Paras, because what he's going to do now is he's going to go through the RX coach approach to questions, and then as you'll see, you'll be able to actually apply these techniques to a couple of practice questions in this session. So Paras, off to you.
Thank you, Dr. Lee. So like Dr. Lee said, today what we're going to do is we're going to go over our question approach that we use in our RX coach program. So we have a 7-step approach. We're going to go over those steps one by one, and then like Dr. Lee said, we're going to apply them to questions. So the first step is pretty simple. It's to cover up the answer choices. You can use a Post-it note, some paper, whatever you have handy. And the reason we do this is we don't want you to become preoccupied by the answer choices and have them guide your thinking before you've even read the question. So this is why we recommend that. And it also helps students from being overwhelmed or feeling confused. So the first step is to cover up those answer choices. And now we'll move on to the next slide, where we talk about step 2, and that is to read the last sentence first. And as we do that, we will highlight or make note of what we believe is important. We do this so that we know what to look for as we read that question. With any luck, this will help us avoid having to reread the question and waste precious time. And now we'll move on to step 3. For this step, we want you to think about how many steps is this question asking you to arrive at the correct answer. So the USMLE can have 1-step, 2-step, 3-step questions. And so what does that mean? Well, if a question's asking for just a simple diagnosis, that would be a 1-step question. If it's asking you what is the drug of choice for a diagnosis, Well, then you need to figure out the diagnosis, one, and then two, know that drug of choice. If it's asking for the mechanism of action of the drug used to treat the condition, well, then you can see that it would be an added step of knowing the mechanism of the drug, and it would be a 3-step question. So like I said, don't worry too much if you don't remember all these steps. This is just an overview. We're going to actually apply these questions together as we dissect some questions. Doing this step allows you to have a clear thought process as you approach the question. So now we'll move on to step number 4. And with this step, we read the question from the beginning, one sentence at a time. And after each sentence, take a pause and highlight or make note of what you think is important. And simultaneously think of what should you be taking away from that sentence. This helps you remain consistent with the question approach and also keep your thought process consistent as well. It also helps you avoid having to reread that question. So this is another step that we recommend. And so now we'll move on to step number 5. Once you've read the entire question, go ahead and reread that last sentence. So at this point, we want you to start thinking of potential answer choices and trying to narrow them down in your mind. So now we'll move on to step number 6. This is an easy step, and this is basically where you uncover those answer choices, where you've been so anxiously waiting to see. Next, we'll move on to step number 7. And for this step, we recommend reading the answer choices, but starting at the bottom and working your way up. We do this to make sure that students are looking at all of the answer choices before picking an answer, and you're not becoming distracted or biased by something else you see that maybe you think is correct. So we start at the last answer choice, cross out answer choices that do not fit what you were thinking up to that point, and then hopefully we'll find an answer choice that fits our thought process, or better yet, we'll find an answer choice that we had thought was the answer to begin with. So then we'll select the answer and move on to the next question. Great, so now that we've gone over our approach, we'll go ahead and move on to the next slide where we'll actually do some questions together. So question number 1. So we'll begin with step number 1, which is, as you remember, is to cover up those answer choices. We've actually gone ahead and done that, so now we'll move on to step number 2. And that's reading the last sentence first. Which of the following is most likely to be observed on the MRI of the patient's brain? Great, so we're looking at a neuro question, obviously, but involving imaging. That's going to be important here. So now we'll move on to step number 3 and try to determine how many steps is this question. I would say maybe that this is probably a 2-step question. I think first we need to figure out what condition this patient has. And then 2, what would you see on an MRI of a patient with that condition? So a 2-step question here. So now we'll move on to step number 4 and we'll read that question one sentence at a time. We recommend you pause briefly after each sentence to highlight what you think is important and also just to keep a nice clear thought process. So you can do this by asking yourself things like, what is important in this sentence? What am I supposed to be picking up on here? For today's purpose, I'll pause briefly after each sentence and allow you to gather your thoughts at home. So this is a 77-year-old man who presents to the emergency department with a headache that began 4 hours ago. He has a history of hypertension and prior stroke. His vital signs are currently stable. His neurologic exam is nearly normal, except that upon finger-to-nose testing, the patient overshoots and undershoots with his right arm. Results of a CT of his head demonstrate no acute hemorrhages. He is referred to the neurology service, which decides to order an MRI to further evaluate for brain lesions. So now that we've read that, let's move on to step number 5 and reread that last sentence. Which of the following is most likely to be observed on the MRI of this patient's brain? Now remember, we determined this was a 2-step question, 1, figuring out a diagnosis, and 2, thinking of what we'd see on that imaging. So I want you guys to take a second to think of what answer you'd like to come up with. And now we'll move on to step number 6, and we'll uncover those answer choices. So we'll show them to you now. And so now you can see this is step number 7, and we'll start with answer choice E, and we'll work our way up. Answer choice E, right cerebral hemisphere infarct. D, right cerebellar hemisphere infarct. C, left cerebral hemisphere infarct. B, left cerebellar hemisphere infarct. And A, cerebellar vermis infarct. So I want you all to wait a second, gather your thoughts, and we will go ahead and talk about the answer in just a few seconds.
All right, so once you have an answer in your head, we'll pop up a poll and you can share your thoughts. So here we go. Let me pop it up. So we'll be launching the poll. So please click in your answer, and then we will share the results with the entire group. Looks like we've got a favorite or two here that are starting to emerge, but we only have about 20 folks, 20% answering. So definitely can use some more input. Go ahead, even if you don't know the answer, take a guess. Looks like it's interesting. It's watching a horse race. We got two favorites, but they're kind of like going back and forth here. All right, we've got close to 2/3 of you folks who've answered. So I think there's enough where we can close the poll. Here we go. I'm closing it. I'm going to share it, and as you can see, there are two favorites here. In the lead is answer D, the right cerebellar hemisphere infarct, but closely followed by left cerebellar hemisphere infarct. Okay, and then scattering votes in the rest. Right. So let me go ahead and actually show you the actual answer, which is, which is D, right cerebellar hemisphere infarct. So so the crowd got it right, but it was only 36%. So this was a bit of a challenging question. So let's talk a little further.
Thank you, Dr. Lee. So great job, guys. Yep, it was very nice of you guys to pick up that this was a cerebellar infarct. So as we mentioned, the key clues here, and the one important finding, is that physical exam finding with issues of finger to nose testing. That should really clue you in that this is an issue with the cerebellum. A lot of the fine touch and fine motor movements of the distal extremities, the hands, the feet, are under cerebellar coordination. So as a lot of you picked, this was some sort of cerebellar infarct. But the thing to remember is that cerebellar coordination crosses twice as it communicates down that spine. The first is midline before it reaches your red nucleus, and the second it crosses before it projects to the spinal neuron. So the cerebellar tracts cross over twice. So if you have a lesion, cerebellar lesions are ipsilateral to the observed deficit. So in this case, the deficit was on the right side, so the observed lesion would be on the right cerebellum as well. It's ipsilateral. So that's why answer choice D is the correct answer and not answer choice B. That would be if you were to have issues left-sided. In terms of why the other answer choices are incorrect, cerebral infarcts would lead more to motor deficit that begins with hyporeflexia and then progresses to hyperreflexia, which is now what we're being told in this question. And then answer choice A, the cerebellar vermis, that's something where you would get like a broad-based truncal ataxia, almost like someone who is drunk and trying to walk. That's the kind of physical exam findings you would find with that. So the main takeaway from this is what was the important clue in that question, which was that physical exam finding. Hopefully you figured out that it was a cerebellar issue, but then taking it a step further to know that cerebellar lesions are ipsilateral in this case. And so now we'll move on to question number 2. So great job on question number 1. And again, we've gone ahead and done that first step, which is covering up those answer choices. So now we'll move on to step number 2, and we'll read that last sentence first. Which of the following physiologic locations is affected in this patient's disease? So now we're looking at a nice physiology question, and now we'll move on to step number 3. And that's figuring out how many steps this question requires. I would say, maybe this is a 2-step question as well, figuring out the disease the patient has, and then knowing the location, the physiologic location that is affected in that disease. So probably a 2-step question here. So now let's move on to step number 4 and read that question one sentence at a time. A 40-year-old man presents to the emergency department complaining of blurred and double vision that started this morning. Initially, the patient's vision was only slightly blurred and he was having trouble with focusing. Over the next several hours, he began to experience double vision. He reports that none of his contacts are sick and that he has not traveled recently. He is self-employed at his own home he's self-employed at his own home canning company. On examination, the patient's pupils are 8 millimeters and minimally responsive to direct and consensual stimulation bilaterally. Gaze is grossly disconjugate and the palpebral fissures are narrowed bilaterally. Lingual, labial, and guttural phonation are abnormal on examination. Strength is 4 out of 5 in the bilateral upper extremities and 5 out of 5 in the bilateral lower extremities. Muscles are non-tender. Serum creatinine kinase is normal. Sensation is intact to vibratory sensation, fine touch, and pinprick throughout. So now that we've read the question, let's move on to step number 5 and reread that last sentence. Which of the following physiologic locations is affected in this patient's disease? So hopefully you guys are starting to think of some diseases that could be at play here, and then where that is physiologically taking place within the body. So now we'll move on to step number 6, and we will go ahead and uncover those answer choices. And again, for this, we will start at answer choice E and work our way up. Answer choice E, presynaptic nerve terminals. D, muscle fibers. C, brainstem. B, anterior horn cells of the spinal cord. And A, acetylcholine receptors. So we'll give you all a couple seconds to gather your thoughts, and then we'll go ahead and open up a poll and let you select the answer that you think is the correct answer.
All right, hopefully everybody got an answer in your mind. So I'm going to go ahead and open the poll so you can register your answer. So here we go. The poll is now live. So go ahead and give us an answer, and we'll keep this open for about 30 seconds to get the results. Okay, we've got about 20% of you folks coming in. I think this will be interesting. I think there's a couple of choices that I think you guys are definitely considering. All right, we're close to 2/3. Let me give it a few more seconds and then we will close the poll. All right, here we go. Let's do it. Let me share the results. And you can see, again, definitely a horse race. A, acetylcholine receptors is slightly in the lead, followed by C, brain stems, but not too far behind is presynaptic nerve terminals. So let's actually get back to this and then see what the actual answer is. And it is E, actually, presynaptic nerve terminals. So about 22% of you guys got that. So this should be a very interesting discussion. Let's get back to Paras.
Thank you, Dr. Lee. Yeah, so this was definitely a tough question, guys. So there were a lot of key findings and things that they told us in that vignette. So first and foremost, the most important thing, I think, is that he owned his own home canning company, okay? This is suggestive of adult botulism. So adult botulism is where you have descending paralysis, and you also start to develop diplopia and dysphagia, a couple things that this patient was developing as well. After that, you can then develop muscle weakness, and then eventually respiratory failure and even death. So the organism responsible for adult botulism is Clostridium botulinum, and it can be found in contaminated home canned goods. That's one of the key buzzwords or characteristic things that you'll find it in. So the important thing is knowing that this organism is a spore-forming organism, and those spores are very heat resistant. So improperly canned foods may not reach the temperature necessary to destroy those spores. So those organisms would produce botulinum toxin, which cleaves synaptobrevin, and that prevents the release of acetylcholine at the presynaptic nerve terminals of the neuromuscular junction. So once again, it prevents the release of acetylcholine at the presynaptic nerve terminals of the neuromuscular junction. So that's why answer choice E is the correct answer. We'll briefly review the other answer choices to talk about maybe what you guys were thinking with those. So D, muscle fibers, that would be something where you're thinking maybe polymyositis or dermatomyositis. Both of these can really manifest with proximal skeletal muscle weakness, and you would normally see an increased creatine kinase, which we don't see here. Furthermore, they also told us the muscles are non-tender. C, I think this was a highly selected answer, brainstem. So this would be getting at something like an infarct or a hemorrhage of the brainstem, where maybe you're getting cranial nerve findings with sensory loss. However, that usually presents ipsilaterally, and a hemorrhage or an infarct is really at onset is really full symptom. It's not something that progressively gets worse like this. And furthermore, this patient is having bilateral issues, which makes brainstem less likely. Answer choice B. So this is getting at poliovirus, and I think a few of you selected this. And these patients experience asymmetric proximal muscle weakness, lower motor neuron signs, of which this patient doesn't have any. And then lastly, answer choice A. This was probably the closest one I think that people selected, but that is actually getting at myasthenia gravis, which affects the acetylcholine receptors. As mentioned, adult botulism actually just affects the presynaptic nerve terminals, not directly the acetylcholine receptors. So hopefully you guys were able to understand that question. Great job again. We've covered our approach to 2 questions now, and let's move on to that next question, that final question, and hopefully we can do a great job with this and take it home. So question number 3. So once again, we've gone ahead and done step number 1 and covered out those answer choices. Step number 2, we're going to read that last sentence first. Which of the following most accurately describes the mechanism of action of the second medication given to this patient? Great, so we're definitely looking at something in regards to pharmacology. So now we'll move on to step number 3 and try to figure out how many steps this question requires. Well, this probably looks like a 3-step question to me. I think 1, we need to know diagnosis. 2, we need to know what that second medication was, which can be used for this diagnosis. And then 3, what is the mechanism of action of that treatment? So these are all important things to keep in mind so that as you start thinking of things, you can start to let other things populate in your brain. So now let's move on to step number 4 and read that question 1 sentence at a time. A 12-year-old boy is brought to the emergency department for his 3rd episode of generalized convulsions. At the time of his arrival, seizure activity has been ongoing for 14 minutes. He is alternately contracting and jerking his extremities in a rapid manner. After administering intravenous diazepam, another anti-epileptic drug is started. Once the seizure activity subsides, the patient is continued on that second medication to prevent recurrence. So now we'll move on to step number 5, and we'll reread that last sentence. Which of the following most accurately describes the mechanism of action of the second medication given to the patient? So great. So I want you guys to start thinking of the answers to those 3 steps that we talked about. And now we'll go ahead and move on to step number 6, and that is to uncover the answer choices. So now with step number 7, we'll work our way from the bottom and work our way up. E, increases the frequency of chloride channel opening. D, increases the duration of chloride channel opening. C, increases GABA by inhibiting transaminase. B, blocks the thalamic T-type calcium channels. And A, blocks sodium channels in motor cortex neurons. So once again, we'll give you guys a few seconds to gather your thoughts for this 3-step question. And we'll go ahead and open up that poll and then select the answer that you think is the right answer.
All right. Hopefully everybody's got an answer in their head. I'm going to go ahead and open the poll right now. All right. Go ahead and submit an answer, please. Let's make it a good one. This is the last one. All right, about 25% have answered. About half of you have answered. So looks like here we're probably one seems to be a bit in the lead. We'll see if it holds. All right. All right, about 2/3 of you have answered. So let me go ahead and close the poll. I think we've got enough responses here. I'm going to share the results here. And the lead answer, but not by a lot, is A, blocks sodium channels in the motor cortex neurons, and follows more closely by C and D, increased GABA by inhibiting transaminase, and increases the duration of chloride channel opening. So definitely a lot of different opinions here. So let's see what we got. The answer is A. So you guys nailed it. So let's hand it back to Paras to take us home.
Thank you, Dr. Lee. So great job, guys. Another tough question. So this patient has been seizing for 14 minutes. So he meets the criteria for status epilepticus. Previously, the duration used to be greater than 30 minutes, but now it's greater than 5 minutes with continuous activity or multiple seizures without returning to baseline. So the first treatment is administration of an IV benzodiazepine. And they actually told us in this question that he did get diazepam. So that was the first treatment. The second treatment after IV benzodiazepam is IV phenytoin. Okay, so the first treatment, benzodiazepine, that would serve to rapidly control and abort the seizure, while the second treatment, phenytoin, that also, if that doesn't work with just the benzo, the phenytoin will then help, and it can also act to prevent recurrence and can be used long term. Phenytoin acts by binding to the inactive form of sodium channels, stabilizing them in a closed conformation. So that's why answer choice A is the most correct answer here. But let's briefly talk about the other answer choices. So answer choice E, I see that you guys, not that many people picked that, which is good because that's talking about benzodiazepines, and that was actually the first drug given to this patient. D is looking at something called phenobarbital. That can be used for status epilepticus, but normally after phenytoin, if phenytoin fails. So that would be a third line treatment. Answer choice C. This is getting at a different medication not normally used for this condition. And then the thalamic T-type calcium channels is getting at ethosuximide or valproate. Sorry, valproate is the drug for answer choice C, and ethosuximide is the drug for answer choice B. And both of those are not part of the treatment of status epilepticus. So great job on this question, guys. Hopefully you guys were able to pick up on the steps that we recommend students use when approaching and dissecting a question. And I will pass it back to you, Dr. Lee.
All right, so let's wrap up and sum up a couple of things that Paris kind of discussed. So, as you can see, we have a 7-step approach. We're not saying it's the only way to do it, but we think this is a really good way of doing it, for multiple reasons. And if you stick with a, kind of a ritual, it helps, you block out the noise, helps you concentrate and focus because you always know what to do next. You saw how, when we systematically, covered the answers and then looked at the actual question and then broke down the number of steps, it forced us to really utilize everything that the question was saying, not just what they're saying, but also breaking down and analyzing it. And you saw that all the questions we had were multi-step questions. So they're integrating multiple things like diagnosis, then treatment, and then mechanism of action, like we just did in that generalized seizure question. More broadly, when we talk to students and we're coaching students, and I'll certainly ask the arts coaches to chime in just a bit. These are things that we find to be useful and high yield preparation tips. One is establishing a study schedule and sticking with it. There's a way to rationally do that. We have our own study schedule, and Jeff will drop a link in there if you haven't seen it already. To that study schedule, we use that when we build study schedules with the arts coach, help build study schedules for their coachees, if you will. The other thing is use evidence-based study methods and use them to integrate what you learn. Then save crammable subjects towards the end. We know you don't want to cram and you shouldn't be cramming, but certain things like micro, farm, metabolic pathways tend to be easier to cram, especially when you're wrapping up in the last few days. You want to, obviously, not only stick with a high yield material, but stuff that you previously learned that's high yield, because that's already easier to keep in mind. Try not to overschedule, even if you're in a dedicated study period or you're out of school and you've got all the time. You want to make sure you pace yourself so you don't burn out. So make sure you get exercise, be with friends and family, that type of stuff. And then, as we say in first aid, we want you to stay relaxed and grounded. This is a marathon, not a sprint. In first aid, we have a whole checklist that will help you keep track of everything. And so that you have a deliberate approach to preparing and maximizing your chances for success on the step one, and therefore getting into the residency you want. I'll pause there to see if Paras or any other coaches have anything to add.
Thank you, Dr. Lee. Excellent webinar, great tips as always. One of the things that Paras and I, as well as Alec, we always encounter is the reluctance for students to want to take a practice CBSA exam available by the NBME. We really encourage you to take an NBME. A lot of students say, I'm not ready to take an NBME exam or a CBSA practice exam. Remember, you don't have to be ready to take an assessment. You take an assessment to get ready for the test. And if you're one of the people in the crowd today saying that, oh, I knew that, but you still got it wrong. If you keep telling yourself, I knew that, but you're missing the question, then that may be due to a lack of efficient or proficient test-taking skills. So be sure to reach out to us at rx-coach.com. We'd love to help.